Well, thank you for inviting me to speak today. I'm going to be doing a very quick overview of the evidence in the epidemiological literature on the health impacts of exposure to smoke. So this is mainly focusing on populations living downwind, not at individuals who are directly in harm's way at the fire. And so the first thing, and this comes from some reviews that I've written, but I'm also trying to update it with some newer studies. But because of the brief nature, I won't be able to cover everything. So overall, there's lots of air pollutants emitted from wildfires for which we know that there are health impacts. But most of the evidence in the epidemiological literature focuses on particulate matter. Most of it is focused on fine particulate matter, so PM 2.5. And those are the smallest, well, not the smallest, but they're very small particles. And the concern about the particles is that the smaller particles can get deeper into the lungs. And just to show you an evidence for size there, the PM 2.5 particles are the little small pink compared to a follicle of hair or a grain of sand. So very, very small particles. And when you look at a smoke plume, most of what you're seeing when it's really a dark, smoky cloud is the particles. And so first, before I get into the evidence, I want to talk about some of the challenges in studying wildfires, wildfire smoke exposure. And one of the difficulties is that we don't know when a fire is going to happen. So as a researcher, when I'm trying to study the health impacts, I'm looking at it after the fact, and therefore have to rely on health data sets that are regularly collected. And this comes from a paper published by Wayne Cassio, where it shows that almost all of us in this room would have everyone exposed would have some subclinical effects for which we would feel no symptoms. But as you move up the pyramid, the more susceptible individuals might experience symptoms that they might be able to report. They might use their medication if they have asthma or other respiratory disease. And then only when it gets more severe would someone go see their doctor, go to the emergency department, end up in the hospital, or the most severe outcome on there is death. And so when we're looking at it as a researcher, we tend to focus on death records, hospitalization records, or emergency department visit records that are available and regularly collected. And only a few studies have been able to look at physician visits or medication refills and or symptoms. So in a way, we're only getting the tip of the iceberg here in terms of the health impacts from smoke exposure. But when we look at that literature, almost every study that has investigated associations between smoke exposure and respiratory health outcomes has found a significant association, particularly for asthma exacerbations. So this is when individuals who have already been diagnosed with asthma end up in the emergency department or being hospitalized for their asthma, and it's coded as such. Similarly, most of the studies, although not all, find a significant association for chronic obstructive pulmonary disease. And then there's growing evidence, but it's not consistent across studies, of a link between smoke exposure and respiratory infections. But the respiratory evidence is pretty clear in most studies. It's not moving forward. I'm having trouble here. Okay, but we're also interested in other health endpoints. With cardiovascular disease, I put up an image here just of how we understand how fine particles could affect the cardiovascular system. And we breathe them in, they get into our lungs, it makes sense how it would affect the respiratory system. We also know that those particles can affect the cardiovascular system through 3 different pathways. And we know this through evidence in epidemiological studies to particles from other sources and through toxicological studies. So it can cause pulmonary oxidative stress and inflammation that can spill over throughout the body and affect the cardiovascular system. It can trigger the autonomic nervous system, and then some of the smallest particles can actually cross into the bloodstream and have been found throughout the body. But when we look at wildfires, the early studies did not find significant associations, And I used to have on this slide, when I've used it in other talks, that most studies to date had shown no associations between wildfire smoke exposure and cardiovascular disease, but I've changed that to many because there's been newer studies, and quite a few newer studies, that have found significant associations. And some of these studies are looking at particularly sensitive populations, the population over 65 or the populations who already have heart disease. Some of them are looking at very specific endpoints, like out-of-hospital cardiac arrests. And then some of them are looking at multiple fires, not just one specific event, but across many different fires where you have more statistical power to detect an effect. And I do think that those are possible reasons. But there are also possible reasons due to the actual severity of the exposure. So it could be much higher levels of particulate matter for longer periods of time. Some hypothesize that it's the chemical composition or how we assess the exposure. And I'll talk a little bit later this afternoon about exposure assessment in epidemiological studies of wildfire smoke. And so we need to do more research to understand these differences and why we're seeing significant findings in some studies, but not in others. There is clear evidence from a few studies, one from Australia and a couple from Europe, of an impact between wildfire smoke and mortality. These are in studies that have looked at metropolitan areas that are exposed to smoke almost every fire season, and therefore over many, many years they can detect this association where you do see an increase in deaths associated with the days affected by wildfire smoke. However, as of yet, we don't see that for specific categories of deaths, and so there needs to be some more research there to understand possibly what causes of death, and that could possibly get to some of the mechanisms. There's a large and growing literature on the effects of air pollution in general on birth outcomes, but there's been much less from wildfire smoke and birth outcomes. This is an example of a study that I was involved in where we were looking at the 2003 Southern California wildfires. And we compared births that intersected at all with this wildfire period in the South Coast Air Basin, and compared that to babies that were delivered before or conceived after in that air basin over a multi-year period. So we did have comparison for the same time of year. And we found a small but significant decline in birth weight associated with being exposed in any trimester, with more significant associations in the second and third trimester. This is only one study. It's a very small effect, but it's over a very large population. We know that birth weight can have an effect on long-term health outcomes, and therefore we need more research to look at other possible birth outcomes and maternal health during wildfire smoke. We just saw the mental health impacts from a wildland firefighter. If you were here during the lunch period or earlier today, there was also the mental health impacts on people who lost their home. In the scientific literature, there's a lot of studies that have found effects on post-traumatic stress disorder and depression. Most of these are of populations that have lost property or a loved one and or been evacuated. There are some concerns from these studies that it's after the fact and they're going back and interviewing people and doing surveys, and people are both estimating their exposure to smoke as well as their mental health impacts. So there's some possibilities of self-report bias there. But I still think that this is an important finding. But when we talk about populations exposed just to smoke, the best evidence I have of this comes from a paper that was a qualitative study. They did in-depth interviews of individuals in a few communities in the Northwest Territories in Canada. Many of them were First Nations communities, and they interviewed them, and some of the quotes are particularly telling about the mental health impacts of a summer in which it was so smoky that they were told to stay indoors, and or they stayed indoors for their own reasons because the air quality was so bad and felt like they had lost their summer. This paper tells about the feelings of isolation, feeling not being a part of the community because of staying indoors, not getting the physical activity that's necessary, as well as the fact that they felt like they had lost the summer. And in a community that far north, the summer is really important because the winters are so long and cold and dark, and the summers are the time when there's light and time outside and a lot of community engagement, and it also contributed to a sense of loss of nature. And so just thinking about this from a perspective in California, where the past 2 fire seasons have had so much smoke covering so much of the state, and the recommendations to stay indoors and what that might have an impact on if this becomes a regular thing every summer when people are being told to stay indoors, and the concern about the environment and the potential mental health impacts. Most of the studies look at PM. This is just from a recent study just published last week that I was the first author on, where we were looking not just at PM 2.5, but also ozone from fires. And we found an association with respiratory health impacts from ozone. But once we put the particulate matter into the model, all of those findings went away. And so at least for this fire, it was one of very few studies that have examined ozone from wildfires. I think it's an important contribution to the literature. However, we know that the ozone impacts from fires differ by type of fire. Thank you. And so more research needs to be done on this because of whether or not there's the background concentrations of ozone and the precursors of ozone can differ in different places, as well as the fire's impact on the ozone. And we think that the difference and why we saw most of the impact from PM 2.5 from this specific fire is because each of those circles there is an estimated level of PM 2.5 or ozone on a zip code day. You can see that the PM 2.5 levels during the fire are so much higher than before or after, versus the ozone levels were only a little bit higher than the normal levels. And this is also during the summer, where we might have seen that increase in ozone during that time period as well. I also think it's always important to think about not just the total population, but specific subpopulations that might be more impacted. And this comes from a review, or actually a meta-analysis by Kondo et al. That was published just this past year. And they found that only 10 studies in the literature had examined effect modification by different characteristics of the population. So it limited their ability to look at the differences by subgroups. One of their key findings shown here was that there's actually was a protective effect during the fires of lower levels of respiratory emergency department visits for children for youth compared to adults and the elderly. Thank you. And then for differences by sex, they found that women were much more likely to go to the emergency department for respiratory health impact. However, that was heavily influenced by one of the studies that looked at that, which was my own. So it's possible that we need to look at this more in some other places. They found too few studies had looked at the socioeconomic differences, and that each of those studies had looked at different characteristics of socioeconomic status, and therefore it was hard to state for sure what the differences were. And then even fewer studies had looked at race and ethnicity as differences. And so I always end this with things that we still need to study. So we definitely need to think about the long-term health impacts. I've had many people ask this of me: what is going to be the long-term impacts on my respiratory health of being exposed to this very large fire, or of that of my children? And at this point in time, there's very little research to look at that, to understand that. We need to look at other health endpoints that have been associated with other sources of air pollution that might be associated with these very high exposure but short duration events, such as wildfires. We need to better understand what are the differences in what's causing the differences in finding. Is it about the exposure assessment? Is it the duration? Is it the chemical composition of the smoke? Is it the fuels that are being burned? We definitely need more research into differential susceptibility and vulnerability. We need to look at other air pollutants in addition to ozone. There's some other air pollutants of concern, some gases that we should look at. And then I'd also think we need some more epidemiological analyses of the effectiveness of the public health interventions that are put forward. And I'm listing all of the references I've cited in this study, and I'm happy to share articles with anyone here. And with that, I guess we're not moving on to questions now, but later. Thank you.